I'm Dr. Justin Beaupre. I am an assistant professor in healthcare administration here at King's College, and I am one of the newest faculty members to our program. I am also a 2011 graduate of this program, and I bring to the program a kind of a deep dive understanding of population health management, as well as having a background in sports medicine and health science. So population health is a relatively new term for many. However, in healthcare, it's been around for some time. So it came out of the concept of the Affordable Care Act, where we are really focused on value-based care. What does that mean? It means that we are interested in providing care that really engages our patients to think about the health choices that they make and make informed decisions between themselves and their provider to improve their health. We also look at health determinants and the factors and conditions that exist in the community that can shape our health outcomes. The community of healthcare is changed dramatically, even in the past decade. The landscape is really focused on a variety of places and spaces, from health happening in the community itself, looking at where we live, work, and play, as well as factors within the walls of the healthcare system, particularly focusing on things like affordability, quality of care, access to care. So, there's really a lot of opportunities within a Master's of Healthcare Administration to dive into different places and spaces, both literally in the community and, in those different areas of the healthcare sector. What can I do with a healthcare administration degree? There's many different directions, and I think here at King's we give you exposure to a lot of different places that you can go. Myself, for example, I have an athletic training background, and I have ventured out toward the population health, public health, community health space. Some of our students have gone on to work with the pharmaceutical industry. Many of our students are actual practicing clinicians, whether it be a physician assistant, an actual physician, RNs, etc. So at King's, one of the great things about this program is we expose you to a lot of different avenues that you can take this degree. Like I said, ranging from community-facing work and service learning to your traditional healthcare administration running a healthcare system or a community-based practice clinic. So students interested in a Master's of Healthcare Administration come from a variety of backgrounds, and the question is this right for me? Simply put, do you have an interest in healthcare and healthcare delivery? Do you have an interest in working with patients, working with clinical staff, physicians, healthcare leaders, to really transform the healthcare landscape and raise the health of your community? And I think that's who we want, those students. So like myself, I started with an athletic training degree. Yes, that's still healthcare, but we do have students who come from the social sciences. They come from the business school. Here at King's, they have philosophy and ethics backgrounds, and all those are important parts of how we think about health and healthcare and how we design interventions and programs for healthcare. Online learning has changed a lot in the past few years, and here at King's, we really think it's important that our online experience is interactive and connects our students with one another, recognizing that our students come from all different backgrounds. Some are our traditional graduate students, so they're coming right out of undergrad. Others have been working in the healthcare sector for many, many years. With that in mind, we have a lot of opportunities through platforms like Zoom and other technology here at the college to let students have a virtual face-to-face experience, so they can talk about some of the issues that are going on in healthcare. They can problem solve some of these complex issues in a face-to-face type environment. Our courses are project-based learning, so you are solving real healthcare system issues in groups. There's a lot of collaboration. And yes, we also still have your traditional, some recorded lectures, your discussion boards, weekly readings, but I think we do a really good job connecting our students to one another so that they can really understand what's going on in the world around them from a healthcare perspective, and network with one another in as close to a face-to-face environment as possible. And an additional value to online learning is this concept of asynchronous learning. So learning at your own pace versus synchronous learning where you're physically in a classroom at a set time. We really understand here that many of our students are working professionals, and to expect you to be here, in the middle of the day isn't always realistic. So, online learning creates a platform where, you manage your experience while we still have opportunities where you are, virtually face-to-face for some synchronous sessions so that you can network and meet your classmates in a more, engaging way. Most of the program runs in an asynchronous format, allowing it to adapt to your daily routine and be as flexible as possible. Dr. McGowan and I complement each other really well with our backgrounds. Dr. McGowan is a business, has a strong business background focused on, the insurance marketplace, finance, accounting, the hospitality industry. So she really understands the business side of healthcare. My background is, part clinical as an athletic trainer, being out in the field providing sports medicine care, as well as now focused on population health and thinking about what are the upstream things that happen. And that's a really important bridge to have in a program like ours where, we want students to, yes, know how to run a healthcare system or to do the business side, but we also want our students to leave here and know what goes on in the communities that I'm practicing in that is shaping why patients are coming to my healthcare system in the first place. And what do I need to do to address those things? And what is the role of the healthcare system in fixing or managing or addressing some of those complex issues that start in the community and affect outcomes? We are really excited to announce a new relationship with Thomas Jefferson University in Philadelphia, specifically their College of Population Health. During my time as a postdoctoral fellow, I had the opportunity to connect with a lot of their faculty and staff, which led to this agreement. Students will now have the opportunity to apply to both Kings and Jefferson at the same time, and with the intent of going on to earn either a PhD in population health management or a Doctor of Health Science in population health. They will apply here and to Jefferson at the same time, and assuming that they meet the curriculum requirements, et cetera, they will, earn a terminal degree. For those students who are like me and figured it out a little bit later in life, they are still eligible, and we will work with those students to also go on to earn a terminal degree. The relationship also brings new urban health opportunities to King's College students. So, they can dive into forums, symposiums, lectures, trainings to really understand what goes on in urban healthcare that might be different from rural healthcare, which they're mostly exposed to here at King's. King's is a wonderful place to learn. As an alumni from here, I think one of the things that makes King's stand apart is, one, we are a Catholic institution, and we are deeply devoted as an institution, as faculty, as staff, as students, to improving our community and improving the lives of the people that we all go on to serve, no matter what your career path is. We are a teaching institution primarily, which means that our focus as faculty is really on our students and making sure that we provide our students with the knowledge and the frameworks to make you socially and ethically responsible leaders in your communities so that you can go out and really leave the world a better place than when you found it. And that is deeply rooted in the vision and the mission of King's. And our faculty and staff really do believe that and practice that every day.